I always thought sugar leads to diabetes, though. So, but sugar leading and to kidney disease, like,
Yeah. So the risk factors for kidney disease, the top two things are diabetes and hypertension, high blood pressure.
okay,
So if you're pre-diabetic, you're at risk of becoming a diabetic, and if you're a diabetic, you have a very high chance. In their lifetime, a diabetic person has a 60% chance of having kidney disease.
okay,
So it's a very big risk factor for us.
got it. So basically, anyone with diabetes, hypertension, and other risk factors
Yeah.
with kidney disease,
Yes.
they should be very vigilant to make the diagnosis earlier.
Yes. So with kidney disease, the problem is that most people are not aware of this. When I
Okay,
say people, I mean also providers, even physicians are not as aware of thinking that they need to take care of the kidney part,
okay,
because it's usually not. And mostly most of the people have heard of heart disease, they've heard of diabetes, but most of the people, kind of kidneys kind of fades as a subspecialty rather than something that a primary care can handle.
okay,
At least early chronic kidney disease can be handled, so that it doesn't progress very rapidly by a primary provider. The way I look at it is that there's a general population. Everybody should have a primary provider that you see, as per recommendations, maybe 1 to 3 years, depending on your age and other factors in your body. Out of the general population, there are some people that have a higher risk. So
got
if
it.
you have diabetes, hypertension, family history of kidney disease, if you're a smoker, if you're using any kind of drugs, then if you have cancers of different types, because cancer itself can hurt the kidney,
Okay,
and the chemotherapy medications that we use, they can hurt the kidney. If you have lupus, there are a lot of these autoimmune diseases that have a manifestation in the kidney. So those are the people that are at high risk for having kidney disease.
got it.
So from general population, let's pick that group out who have a high risk. The high risk people should get monitored yearly. So you want to get a blood test, you want to get a urine test. With just these two tests, you can find out if you've started having kidney disease.
Okay,
So, at risk, moving to having kidney disease. Once you have kidney disease, now we start monitoring for progression. That how badly is it getting, how quickly is it, when I say progression of kidney disease, I mean how badly is it getting worse?
okay,
How quickly is it getting worse? So, some people's, trajectory can be a very rapid trajectory. Some people can go for years without having a lot of problems. So, once I establish that, okay, this is kidney disease, and I establish a trajectory,
mm-hmm.
now at some point we start looking at complications.
Okay,
So, of the people that have kidney disease, there will be some people that will progress on to having complications of kidney disease.
okay,
At some point, during this time, we'll start looking at replacing the kidneys.
got it. So I will request a pause here because I have a lot of questions out there. So you started with that patients who are at high risk, we should get a blood test and urine test. What are those tests?
Yes. So, most of them are pretty routine. They
Okay.
can be done in primary care. We like to get a complete blood count.
Uh-huh.
I told you kidneys make your blood. So,
Uh-huh.
you want the blood counts. That's called CBC. You want a renal panel, which
Okay.
includes creatinine. And nowadays, we've started including another marker called cystatin C.
Okay.
We like to use both those markers to come to we have some risk calculators where we'll need to plug in these numbers. We want to know all the electrolytes because your kidneys, remember, they're managing your
Yes.
sodium, potassium, everything. So that renal panel has all of that.
Uh-huh.
And in the, we'll also like to look at calcium, magnesium, and phosphorus, especially at least once. We want to
Okay.
see if there's no problem there. And in the urine, we are looking for protein in the urine mainly. But even if there's blood in the urine, we want to know that.
Okay. So do you think someone else will interpret those test results for me, or do I need to know what to look for in those tests?
It's always a good idea to talk to the professionals about it because,
Okay.
if you just look at something and it just looks in the red, it'll cause a little bit of fear.
Okay.
And I don't want you to get stressed about something that you'll need more answers.
Okay.
So it's a good idea to have somebody else interpret that.
So
for you.
basically, I will get the test done, and if I'm not getting my test done, I will request my primary to get the test done. And if the results are abnormal, then I consult my primary physician or a nephrologist. How does that work?
Yeah, your primary will call the nephrologist.
Okay.
The referral will be made by your primary physician.